morning. Welcome again to another day, another dissection. So, today is a dreary day. It was hard to wake up, if I'm being honest. Um, it's cold and just bleh. You can see it. It's cloudy. Bleh. So I am driving up north today, headed up to Clarksville for a day of consults and follow-ups, hence why the hair is done. Usually when I throw it up in a scrub cap, woo, she gets a little greasy. But anyway, that's where we're headed today, so we've got a little bit of time to yap. You know what I'm saying. I've been seeing a lot of posts about tummy tucks lately from like fellow surgeons posting results, etc. So I think we're going to talk about that today. There are a lot of different types. There's a lot of different names for a lot of the same things. That's true in a lot of different kinds of at least cosmetic and aesthetic surgery. And one of my good friends always says, words matter. So the words that you say I think are really important, especially in medicine. Nothing teaches you that faster than when you have to speak to another doctor quickly in an emergent situation, that your words carry a lot of weight and they have a lot of meaning. So it's hard for me to be so flippant about words. And so if you ever consult with me, you'll probably hear me be like, no, that is not what that is. And it's just it's a me thing because it's been drilled into my brain that words matter. So to start out, the different types of a tummy tuck. So there's a big range of sizes of tummy tuck. So there's a mini tummy tuck. And in reality, a mini tummy tuck is really supposed to only address the skin below the belly button. So if you just have like this pooch of excess skin below the belly button and you're happy with the upper abdomen and the way the belly button looks, and it sits up high. If the belly button is down low, it's not going to work very well, and I'll tell you why in a second. But it really and truly is a small incision similar to a C-section size to get excess skin out from the lower abdomen. There's no muscle plication in a true mini tummy tuck, and there's no change to the umbilicus, the belly button. There is no suture around it. There's no incision around it. There's no movement of your actual belly button. It's really and truly a skin excision of the lower abdomen. But there are things you can add on to a mini tummy tuck, which people do very regularly, which is basically a plication, at least of the lower abdominal muscles, which can sometimes help if you have that lower pooch. And then you can also add on an umbilical float. And there are a ton of different things that people call an umbilical float. A true umbilical float is where you transect the umbilical stalk, at least the way I was taught. Now, maybe there are different teachings, but the way I was taught was you transect the umbilical stump at the level of the abdominal wall, and then that floats down. And what happens there is the belly button actually gets pulled further south, but it doesn't still have that tether, so it doesn't make that kind of sad frowny face belly button. It just moves it further south. So if you have someone who feels that their belly button is too high and doesn't like that, and they have that excess skin, they're a perfect candidate for a mini tummy tuck with an umbilical float. Now, finding that unicorn of a patient is extremely difficult. Most patients are not that. A lot of people need their belly button to stay where it is, but they need excess skin removed, and some of that pull needs to come from above the belly button. So you sort of have this tether in the middle of the abdominal wall that stops you. So the way that I usually end up doing a mini tummy tuck to get people the best result possible to also affect some of the skin above the belly button is to do my version of an umbilical float, which is that I cut around the belly button, leave it attached to the abdominal wall, and advance the skin over it. The issue with a mini tummy tuck is that you don't have enough skin removal to remove that prior location of the belly button. So that belly button hole that I cut is still present. So I have to close that, and that means that you end up with a small vertical scar between the belly button and your incision in the end. So the people that want the mini tummy tuck to avoid scarring actually end up with more visible scar than someone who's able to do a full tummy tuck. And a lot of that surgery, that difference between a full and a mini, is sort of decided by the amount of excess skin that a patient has. So a true mini tummy tuck is very rare. A true mini tummy tuck with an umbilical float, a true floating of the umbilicus, is also extremely rare. More commonly, people with excess skin that don't have too much end up with basically a full tummy tuck that's a shorter scar, but ultimately they end up with that vertical scar and pay the price that way. But most commonly, women really need that muscular plication, and that's what's extremely different in someone that does cosmetic tummy tucks versus in the hospital, they do what's called a paniculectomy. A paniculectomy is done usually in the hospital, and that's for someone who has repeated paniculitis, which is really that rash and infection that can happen in the folds of the stomach skin, usually between the stomach and the mons area, that upper vaginal region, and that can be life-threatening, and that's why insurances will cover a paniculectomy. Now, what's different in a paniculectomy? They're really and truly removing excess skin and fat to avoid creating any new folds in that region. So they want to make that area flat. That means they will sacrifice the belly button. Some people come out without a belly button, and they will also not perform the muscular plication because it takes extra time, it's extra risk, and it's more recovery for the patient. And usually they're in a situation where they need an urgent surgery to take care of this problem, and so that's why insurances will cover a tummy tuck, but it's not a real tummy tuck. So the most common tummy tuck that I perform is a basic abdominoplasty. Now with that, the incision is from hip to hip, and we dissect all the way down to the abdominal core, take that dissection all the way up to the ribs, and basically lift the skin and fat up off the abdominal core. I also cut around the belly button to leave it attached to the abdominal wall where it normally lives, and what we're going to end up doing is cutting a new hole in our new advanced skin flap for the belly button to kind of sprout out of. I sort of describe it like a flower when I'm in a consultation. It kind of just, out of a new skin hole. And then we cut that excess skin out, and usually a full tummy tuck, it does cut out that prior hole of where your belly button was, and so you don't end up with a small vertical incision in that lower portion of the abdomen. It's just the lower kind of U-shaped incision from hip to hip and around the belly button. That surgery also includes a muscle plication, and on the internet it's called an internal corset, and I always tell women that that's actually a very accurate name for it. I use a permanent, never dissolving suture, and first I'll do an interrupted row to basically bring back together the abdominal core muscles. And what happens is your core is 3 paired muscles on each side, and it's connected in the middle behind the belly button by a tendon, which is called the rectus sheath. I know it's confusing. Anatomy can be really confusing, but the rectus sheath is what stretches when women have babies, as we gain and lose weight, and that tendon doesn't come back. That tendon stretches and it can sort of come back. It's pretty amazing how much it rebounds after childbirth, but repeated pregnancies or a massive weight gain and weight loss can really affect the rectus sheath, and that leads to rectus diastasis. Sorry, your girl got hot and I had to get my coffee. Must have. Thankfully, this Starbucks still has the pumpkin cream chai. That pumpkin cold foam. Oh my god. I love it so much. It's so good. But I fear it is leaving me soon, and I'm devastated. But I digress. So, the actual plication also has a running layer, meaning that I don't stop to intermittently tie those sutures. I just tie it once and run it all the way down, as a second layer for that muscular plication to really ensure that that stays in place. But that is the bulk of the reason that women have so many restrictions after surgery, is to protect that plication. So that's the main reason for the restrictions, and it's to protect the abdominal core. Now, we are trained to use our abdominal core to protect our back, to stabilize our body. It is one of the best stabilizers of our body. And so trying to not use your abdominal core for ideally 2 months after surgery to allow that scarring and healing to really take place. Don't worry, I'm at a red light. Really making sure that you try to avoid using the abdominal core for anything. So I tell women not to lift, push, pull anything more than 5 pounds, and that's about a full half gallon of milk, which is extremely hard to do because you weigh more than 5 pounds. So pulling yourself up into a truck, pushing the grocery cart up, pushing yourself up out of bed with your elbow, I mean, all those things you really, really, really have to be careful. So the other portion of a tummy tuck recovery is that I do leave one drain in place. Now there are some people I've seen that do a quilted technique and they don't use any drains. I haven't seen it around long enough or seen enough data to really know that that's going to be a viable option. And I think there is a lot of technicality in that, and so it would be something that would need to be practiced. And at this point in my career, I just don't feel okay doing that. Kudos to practitioners that do. I'm sure they do it extremely, extremely well. I know that they would not do anything to put someone in danger. And actually, a really great friend of mine does that in Florida and has had amazing results. So it is definitely possible. It's just not something I'm as comfortable with. And the general surgery just still has that chokehold on me about using a drain in those big dissected areas like the tummy tuck flap. That drain stays in place for about a week. And sometimes longer, and really and truly it just depends on how much is coming out of the drain. You want to make sure that the drain has done its job and drained as much of the fluid as possible. Really, the whole goal is to stop fluid from building up between the fat and skin of the abdominal wall and the area that you dissected. So you want things to heal down nice and close. You don't want to have fluid build up or blood, bruising build up in that area, because then things aren't going to look as good. They're not going to heal as well. And it's just, if it's blood, that can be a really bad place for infection to start brewing. And that can be extremely dangerous for people and require a lot of repeat treatments, more surgeries, things that people want to avoid, including me. I don't want to have to operate on you multiple times. I want the best result right away. And that's the reason that I do that. So routinely it stays for a week. If necessary, it'll stay longer, but that's rare. So other versions of a tummy tuck, that's kind of all the basics about a regular tummy tuck. I can go into recovery in a minute, but there's an extended tummy tuck, and all that is a longer incision that kind of goes around onto the sides. I always am really clear with patients that a tummy tuck, a true tummy tuck, does not affect the flanks or the muffin top that women usually hate. That area is more amenable to liposuction, unless you're a massive, massive weight loss patient where really and truly you just have excess skin. Then you may need an extended tummy tuck or even a 360 body lift, which is basically a tummy tuck all the way around, where you go from the front to the back over the buttock and remove excess skin as you go. That surgery, most people that I've seen doing it, and I haven't seen everyone, most people are doing those surgeries in the hospital because they do take a lot longer. There's a lot more positioning and flipping, and it's just not safe to do it in an office setting like I operate. So recovery. Recovery from a tummy tuck is, like I said earlier, about 2 months if everything goes well. You'll have a drain for 1 week. You'll have dressings in place for 2 weeks that need to stay dry. And then you'll also need to not lift anything more than 5 pounds for 2 months, 8 weeks from surgery. And then you'll also need to not submerge the incisions in pools, tubs, lakes, or baths, or go into any saunas for 8 weeks minimum. Now, if there are wound healing complications, which can happen with this surgery because of its really large incision, if there are wound healing complications, those restrictions could be longer, most notably the submersion. That's going to be the thing I'm the most picky about if we have an open wound, because those bodies of water have bacteria, and when you're submerged in it, that bacteria has more hydrostatic pressure to get within the wound and cause bigger problems. Now, any kind of these tummy tucks, anything that we've just talked about, will absolutely be a no-go if you're smoking. Nicotine specifically. Nicotine really affects small blood vessels, the way they function, the way they form. It stops your body from creating new small blood vessels called angiogenesis, and it stops those tiny blood vessels from functioning. It causes vasoconstriction of those small blood vessels. It also decreases the oxygen carrying capacity of your blood just solely with nicotine. So if you have a nicotine-free vape or anything else that you're smoking that has no nicotine in it, that's not as bad. But any nicotine products, gum, chew, patches, anything will make you test positive, and that will be an absolute no-go for surgery because your wound will not heal. Trust me. And I totally understand the addiction. I mean, look at me, I'm addicted to a cold foam, okay? So I get it, I know how hard it is, but trust me when I say the investment that you're putting into your body will not pay off if you are smoking. And that's the reason that I'm such a stickler about it. I would not want my family member to do that way, and I will not allow my patients to do it that way. Trust me when I say I've seen it gone poorly, and that is 9 times out of 10 the cause. And it sucks and it's hard. And I usually throw a little celebration in the room when patients tell me that they've quit. But that's true for tummy tucks, a breast lift, brachioplasty, anything with a large incision. I'm going to tell you no if your nicotine is positive. And we have other options, less invasive things that we can do. But those big scars are not going to heal well. The other reason I really am a stickler about quitting smoking for a tummy tuck specifically is because you're coughing more as a smoker, because the cilia of your lungs, those little hair-like projections that help sweep pollution and bacteria, anything that our lungs don't need in it, it helps sweeps it out. Those cilia don't function well, and so you end up with a higher risk of infection. You end up coughing more, which increases your intra-abdominal pressure. Repeated coughing is going to put you at risk of damaging that muscle plication that I do. Ripping that plication open, hurts like a lot. Obviously I wasn't going to say a lot there, but censoring myself. It hurts a lot. It puts you at risk for bleeding. It damages your rectus sheath, and you end up with a poor result. And that's not what any of us want. The other thing that smoking does, and this is not specific to a tummy tuck, is it actually suppresses your appetite. And that's why a lot of people lose weight when they take up smoking nicotine products and gain weight when they quit, because it is an appetite suppressant. So the other reason that I don't like it is it suppresses your appetite. And like I've said before, you need good nutrition to heal a large wound. And if you're not hungry and you're not eating and you're nauseous from the meds and surgery and you're in pain and you don't want your stomach to bloat, you are, I can guarantee you, not going to take in enough calories, protein, and building blocks for all of that healing that your body has to do. You're not going to do it. And you're, again, not going to heal well. It also puts you at a higher risk of infection because it affects the way that your body stimulates your immune response at the initial site of injury or infection. So there are just a lot of reasons, so just don't do it. Now, if y'all thought that was me nerding out, that's just like the tip of the iceberg with me nerding out on smoking. I could deep dive into the science behind it and the chemicals that it all affects. And if y'all want that, you just let me know. But a lot of people, friends, tell me that I need to just keep it lighter. So we'll stick with that. And if you want more information on the specific pathways that nicotine affects and how that translates into what I'm saying, by all means, let me know and we can nerd out together because, I'm a big nerd, shockingly. But yeah, that's the basics of a tummy tuck and big incisions and kind of diving into a little bit of recovery as well. So I hope that was helpful. I will be around to answer questions that this brings up. I have also realized that I say so a lot, and a lot. So look forward to me not doing that anymore because I find it really annoying. It's also extremely weird listening to yourself talk on video. I gotta say, very odd. Oh crap. Okay, I'm gonna get better at that. Okay, I'm a work in progress. All right, we're getting there. But the teeth look so straight. If you don't already know, I'm on a mouth journey. I have braces, and it's been a ride, shall we say. I have a tightening this week, so look forward to me eating a liquid diet with protein, since I'm such a stickler for the nutrition. But yeah, I'll get better. Don't worry. So this was episode 3 of Dashboard Dissections. Thank you to anyone who's listening. I feel like I'm just talking to a void right now. of dreary, bleary weather. But I am really grateful for the people that encouraged me to do this. Thank you. It's been weird talking to myself in my car about things that I talk about all day, every day, but I'm really excited to see where it goes and see how people respond, and to also just help educate. If this can help someone who's going to get a consultation that wants to know more information about a procedure before they go in there, then by all means, because I too will panic and get overstimulated and not remember things that the doctor said. It happens to me all the time, so you're not alone. And I just hope that it helps. And if you have ideas for next week, let me know.